Hello everyone, my name is Adela Ayebale. I am a student at Victoria University located in Kampala, Uganda along Ginger Road. I am pursuing a bachelor's degree in nursing science and today I am here to share knowledge about one of the most interesting concepts of psychology, which is motivation, how we apply motivation knowledge at our workplaces during the nursing practice and in our day-to-day situations. The aim of this presentation is to explain what motivation is, the types of motivation, theories of motivation, aspects of motivation, and most importantly, how we apply this knowledge during our patient interaction and throughout the entire process of patient care, from the time the patient enters our facility or the hospital until the time when the patient exits the facility. To begin with, motivation is that psychological force that initiates, directs, sustains a human behavior to act in a certain way towards achieving a certain goal. Then another person can define motivation as that force that directs or shapes a behavior of an individual to act in a certain way or to behave in a certain way towards achieving a certain goal. Motivation has got two types, as we are going to see. The first one being intrinsic motivation, which is the force that is driven by internal satisfaction, enjoyment, dedication, or passion. It's very important in the healthcare due to the environment where we operate from being very stressful. I can give an example whereby a nurse who is working on a patient or on patients with very infectious diseases like Ebola, risking her life out of passion for nursing or dedication. Then our second type of motivation is extrinsic. Extrinsic motivation is that force that is driven by external rewards such as salary, recognition, and promotion. It is also very, very important in the healthcare because the managers use it for disciplining the health workers, especially nurses. As I have already told you about the types of motivation being intrinsic and extrinsic, combined, they can help us in the following ways. They help us to increase the productivity and job satisfaction during our practice. They also help nurses to reduce absenteeism and the staff turnover, since I had already said that it can be used to shape our discipline. Then motivation, it also improves the service, the quality of the service we provide to our patients during care. Proceeding, let's now look at the theories of motivation, and the first one being the hierarchy of needs theory by a great psychologist called Abraham Maslow. This theory was invented in the year 1943, whereby Abraham tells us that motivation progresses from the basic needs to the higher level of needs. For example, if a person's priority need is food, you cannot tell that person about being recognized because recognition at that point is not a need. And this theory helps us as nurses in identification of the needs of our patients and how best we can handle their needs. For example, if a person comes to your facility, in severe pain and poorly dressed, or the outlook is not impressing, don't focus on the outlook. First treat the pain, because at that particular moment the pain is the need that has brought him or her to the hospital. First control the pain, and later you can talk about the hygiene, because the hygiene at that point is not a need. And again, this theory helps us as nurse managers to motivate our fellow nurses or our fellow workers through their salaries, through recognizing them, by identifying which level of needs a person is at, and you satisfy or you fulfill that person's need according to the level where they are. And our second theory of motivation is equity theory, that was invented by a great man called John Stacey Adams in the year 1963. And this theory states that motivation depends on the fairness of a person's inputs, or the efforts, the skills versus the outputs. Yeah, so workers compare themselves with others, even as nurses. In our wards, we'll be comparing our work, the output, with our fellow nurses. For example, the nurses at maternity ward, they can be comparing their work with the nurses at surgical ward. And by comparing their work, they also compare the remuneration or the salary they receive, whereby they all need to be equal in what they earn. But this theory has got some criticism, whereby fairness is just subjective and it is very difficult to measure inputs or outputs. Then we proceed to the third theory of motivation, which is expectancy theory, by also another very great psychologist called Victor Vroom. And this theory was invented in the year 1964. It talks about majorly three things, which is expectancy, instrumentality, and valence. It states that workers motivated plus their performance equals to the rewards I beg your pardon. This theory states that motivated workers, they perform very well and they value the rewards they achieve or they are given if they match with the energy they put in during their performance. The third theory is two-factor theory by a great man also called Frederick Herzberg in the year 1959. This theory majorly talks about two factors, whereby the first factor is the motivator, then the second factor is the hygiene factor. The motivator is intrinsic, the force I had already talked about, that it starts from within an organism and it is driven by things like satisfaction, passion, and dedication. Then the hygiene factors include the external rewards, the salary, the promotion, the food we are given at work, the peace. Those are the external or the hygiene factors this man was referring to. Then another theory is the three needs theory by a great psychologist called David McSutherland. This theory talks about majorly three things, that is achievement, power, and affiliation. As we go to our workplaces, we have some needs like desire to excel and succeed, we be better, we be on top of others. That is the need for achievement. Then the need for power, the influence we have at work, the ability to lead our colleagues, maybe by being nurse managers, being focal people or focal persons. And The other need in this theory is affiliation, the desire or the desire to have a relationship and a belonging. It is very useful for the nurses because they can they can put out their leadership skills and develop teamwork at the workplace. So that's all I had to discuss for us today. But in conclusion, the key important points I want us to take home is that motivation helps us as nurses because we face long hours of duty. It helps us to calm down the stress we get during our shifts. For example, a nurse motivated intrinsically by compassion will go beyond routine duties to comfort patients, to provide the extra care like by taking vitals, reassuring patients. While extrinsic motivators like promotions, they encourage professional growth and development. Then the patient care, nurses use motivation to encourage patients to take their drugs on time, to abide by the prescriptions, and to promote, to adhere with the drugs that are prescribed for them in order to have their health promoted and restored. Then in our day-to-day life, as a student, I am motivated intrinsically by the desire to gain knowledge and extrinsically by the goal of achieving my degree at Victoria University. Yeah, that's all I had to share with you. I hope you picked something, and I hope to share with you again next time. Thank you. I remain as Adela Ayebale, a student pursuing a bachelor's degree at Victoria University. Thank you, everyone.